everyone, this is Anup Kanodia from KanodiaMD. I hope everyone can see me and hear me. I'm going to go to the chat, and for the people that are here so far, can you please tell me yes or no if you can hear me and see me? That will be very helpful. And okay, I'm getting some chat. Yes, Betsy can hear me. Perfect. And what I'm going to do is, so I see a whole bunch of people that are here already. This is awesome. Even if my mom is here, that's cool. You always love your family to be here too. And I think we are going to start. And people that catches on, they can watch the recording. We're going to do 4 parts here. One part is, where is COVID right now? Number 2, yes, David, it is being recorded. Number 2 is, what is this Omicron variant or the super strain? What about all these vaccines? What do we know? And what about protocols to help us? And that a Q&A. Those are the 5 major parts. So let's start with the overall COVID the last couple weeks or a month. What we saw, September, October, November, numbers were dropping, right? We were thinking an endemic was here, oral pills are coming, things are gonna get better. What do we see? We're seeing numbers go up even before the Omicron variant has gotten to Ohio or to the US in large parts. So what do I mean? In South Africa, and I'll give you more data here, that since this new variant is there, they have tripled the amount of cases for people getting it in 1 week, and almost 200% in the last day. Hospitalizations have doubled. So take with a grain of salt what I'm going to say about the current numbers here in Ohio and in the US, because these numbers are going to probably get worse before better, with this new variant going to come in on top of it. Numbers are getting worse. Why are numbers getting worse in Ohio? We'll stick to Ohio for now, and the US. The number reason why things are getting worse right now is we're indoors. When we're indoors, less circulation of air, and also most people are not wearing masks indoors, and they don't have the proper, and some people are vaccinated, some people aren't vaccinated. And so all these things make winter worse for spikes. That's fine, right? Spikes are fine because we get spikes in cold flus, we get spikes with influenza. That's not the problem. The problem is when we have spikes of colds or flus, that doesn't stop your heart surgery or your hip surgery or any other the elective surgeries from happening. Hospitals aren't full. What happens with COVID, even with the best care, we still cannot get people healthy enough to stay out of the hospital. The worry with COVID is that, from the very beginning, is that you will not get the care that you need for any illness, let alone COVID. And so with this new surge, before Omicron is hit, what are we seeing? We are seeing things that I was hopefully wouldn't see at this point. Because 3-4 weeks ago, we were talking about, oh, yep, this is almost over. It was light at the end of the tunnel. So what are we seeing in Ohio? Think back to last January. Hospitals are full. Things are probably at its worst. So long ago to think about all of this past year. But January, February was the peak of the worst of COVID for us in the US. So the number of cases per day in Ohio are at the same level as what we were back in January. The number of new cases per week is at the same level. And the number of hospitalizations are around the same level. That's the hospitalization ones are the ones that I'm like, wow. I would hope by now that we were able to, with primary care, urgent care, all the stuff, we're able to have these people stay out of the hospital. That's not the case. In the last 21 days, hospitalizations have gone up by, cases have gone up by 56%. And ICU beds, people using ICU beds have gone up by 43% in the last 21 days. So what is this telling me? Again, people are still getting very sick with COVID. And again, as we've always said, please put your questions in the chat box, and we'll try to get to as many as we can at the end. It's funny. I was, it is startling. And I've got even some more bad numbers to start with. And these aren't bad. I just want to give you the information. You guys make whatever decision you guys want. They talked about the 6 states that are the worst with like COVID and hospitalizations and stuff. And I was like, oh, you know what? Probably Michigan and other states, but Ohio's in the top 6 in the country. And so that's not something that I wanted. That's good at this point. So what's also interesting is that in Cleveland, Toledo area, and Akron, they are stopping the elective surgeries again. That hasn't happened here in Columbus yet, which is great. But it could happen very soon. It is very possible that these cases are going to start in Cleveland and work our way down to Columbus. I had a family friend, probably at the peak, January, February, March, needed a hospital bed and couldn't get one anywhere in Columbus, even though he was deathly ill. There was just nothing available. And we don't want that to happen to me, to you, to your family members. So what are we seeing in Ohio? 80% of beds are already full, and about 80% of ICU beds are already full. And what we're finding is that we've all heard this stuff, is that it's going on for about 2 years now, COVID. And a lot of doctors, nurses, all various positions of healthcare are tired. They've been working day and night for this pandemic, and there's no ceasing. So another part of this is staffing. And you guys have all probably heard of that, seeing it on all various fields, but also in healthcare. Yep, Angie works in healthcare. She responded, and she's saying yes. So she's a nurse, and that they're having a hard time, nurses, doctors, whatever, to take care of patients. What's interesting is that because the Toledo, Akron hospitals are getting full, those patients are now being shifted here to Columbus. And so hopefully Columbus won't get full beds, but we want to make sure that we don't get that far. So those are some of the numbers of COVID. Bottom line is the numbers are going up, and it's going to probably go much higher before it goes lower. I don't think we're fully seeing Thanksgiving yet and the effects that it's had on our numbers. And these numbers may go higher and higher between now and mid-January because of the holiday season. And these numbers currently of what we have are not reflecting the new variant. And I'm going to go into that, the new variant. And So these numbers may go higher than the worst that we've seen even back last January. Don't know yet, but I was hoping 4 weeks ago that we were on the other side of this. But I think that we are still in the thick of it with this latest surge. That's the first part. And really to answer, when do I see it leveling off? Don't know yet, because first you have to get a peak, and then you want to go down. We've not reached our peak yet, and so that we don't know when it's going to start going down. If last year is any indication, maybe we peak middle of January, and we start going down after that. I think it just depends on this surge and what people do with their health. And we'll talk about what people will do with their health in the fourth stage of this, the protocols, etc. One question was, are COVID cases being sent to specific hospitals? I think every hospital has a different amount of cases they can handle in different units. So if a unit becomes full, hospital becomes full, they might shift it to a different hospital. But same with nursing homes, same with anything. Some people have the protocols, some people don't. Let's talk about stage number 2 for today, which is the Omicron variant. So from a scientist standpoint, this is exciting for me. It means that something new. It's also horrifying that we have a new variant. So this part, you may want to take some notes. The symptoms of the Omicron variant are going to be different than the symptoms of the Delta variant, the Alpha, and the Beta variant. The Delta, I mean, many of the Alpha and Beta had a loss of smell or taste. That's not happening with this one. We're finding mostly sore muscles, tiredness, not feeling well. Almost like a cold-like symptoms. It may be cold-like symptoms to you or I if we're healthy, but then again, for the high-risk people or the immunocompromised people, the cold that I have may cause them very serious illnesses. And again, I don't think we're seeing the Omicron infections right now. Other thing interesting with Omicron is that you can get the infection again. So if you got COVID, you have natural immunity. The thought was, hey, maybe you can't get the next one or be a while. With this new Omicron, there is potential for getting it again, COVID-19. Omicron is much easier to pass on or give to one another contagiousness. We thought that the Delta variant was double as contagious as the Alpha or the Beta. I've seen data anywhere between 200% and 400% more contagious. So I think I'm planning for, and I'm planning my family for, that assume that you're going to get COVID in one form or another. Because it's just so easy to pass back and forth now. And the things are that even when you're vaccinated, you can still pass it on. You may not get symptoms, but you can still pass it on to someone who's vaccinated, a breakthrough case, or to an unvaccinated person. Now, if you get the vaccine and you get exposed to it, how long you're able to give it to someone, you're contagious, is much less than if you didn't have the vaccine. One thing I heard people say is, well, why does it matter the vaccine if I can still pass it on? The thing is that you pass it on at a much lower dose. The amount of COVID in your body is much less, and how long it stays in your body is also much less with the vaccine versus with not. And I'm going to tell you both sides of the vaccine, so you guys can make up whatever decision is best for you and then for your kids or your family. The question is, could the Omicron variant be resistant to our current treatments? I was shocked when I was reading about this, meaning the monoclonal antibodies, those infusions we hear about. The answer is yes. There's a significant possibility that this Omicron, some of our treatments may not work as well because of this new variant. The new variant is giving me pause because of how fast it's going up in South Africa. You heard me say 300% more cases, more hospitalizations. It's in a very rapid clip, and even much faster than the Delta variant. So that's alarming or not good. On the better side is we're finding less severe cases. Well, and that sort of makes sense or doesn't make sense. Why is hospitalizations doubling if they have less severe cases? But people have less severe cases overall, so I'm seeing some of both. People that have it in the community make it less severe case, but there's still a lot of people are getting hospitalized with it. It's interesting about the vaccine is that new data came out today, and I'll talk more about vaccines here, but bottom line is 2 Pfizer, I think probably the 2 Moderna, works 40% worse on the Omicron variant. That's what I see across different platforms or different studies. New study came out today saying that if you get your booster, it moves you back up to that level of 2 shots, 90 to 95%. I just saw that today. So a booster may be able to help with the Omicron variant. And why is that? It's through the neutralizing antibodies. The immune system is being revved up. Meaning what? Every time you get a cold or a flu, your immune system revs up. So when it revs up, it's like on alert for the next infection, whatever it is. But if you never really use your immune system, then it's not ready for an infection. So it's sort of like a car sitting in the garage for a year. Which I turn it on, it's hard to turn over. Same thing, if the immune system's never turned on, it's hard then to be ready for it when COVID-19 happens. So by getting the vaccine, 1 shot, 2 shot booster, you're boosting up your immune system for everything, even if it doesn't fully work on the Omicron variant. And it goes without saying, I guess I'll say it again, Omicron is in America already. So why do we call this a super strain? Or almost like, why is this webinar almost here to some degree? I'm not doing webinars once a week because I don't want to waste your time. But if something is really cool or innovative, then I want to give it to you. So a lot of people are calling this a super strain. And why is that? So when we have a variant, the alpha, beta, delta, the gamma, which we didn't talk much about, there's all these other ones out there too that we've never even talked about. They all have mutations, or they all attack the body differently in the immune system. Those attacks differently, it's going to have different symptoms. easier to transmit or harder to transmit. More infection, less infection. More hospitalization, less infections. Most times you might get one mutation. So okay, the body can handle that. The problem with the Omicron is this. It has 32 mutations. The highest number of mutations we've seen in any variant up to now. Also, the other part that I'm not a fan of or don't like is that it contains all the mutations of the alpha, beta, delta. Then they have all these new ones on top of it. Most time a variant will have like maybe some of the bad stuff of alpha, but it has just one new one. This one has all the bad stuff of all the previous ones, the big ones, alpha, beta, delta, and now it has the new ones on there. And we saw how delta was a predominant strain very quickly around the whole world. So the Omicron has that same potential, and we're seeing it already. And so why is these mutations worrisome? Is because it does a couple things. One, it makes it easier to get into our cells. So it means that if you get Omicron in your nose, it's easier to get into your nose cells, get into your body, into your bloodstream, etc. And it's easier for them to replicate in the body. Go from 2 to 4, 4 to 8, 8 to 16, yada yada. Also, it's more contagious, which we've gone over before. So bottom line with the Omicron is that this is a variant that we should take into consideration, like the Delta, and that it's going to cause different symptoms, and that we should be on the lookout for it. And we still have not seen it in the US predominantly. With that being said, it may have less symptoms, but hospitalizations are still going very high in countries that have Omicron as the predominant strain. So I would still take this seriously, even though it might have less symptoms. I would take this seriously because the vaccines don't work as well against this variant versus the Deltas, etc. If you have questions about this variant, put it in the chat box and we will try to get to them at the end. What I'm going to do today is try something different format or answer the questions at the very end. That way then we can keep the flow going. Part number 3 on this. I guess I'm going to talk about what we can do about the Omicron variant at the end. Vaccines. I've been reading a lot about vaccines, pros and cons. And I'm going to start off with some cool stuff first, before we talk about other things about it. Number 1, there are 2 vaccines that are potentially going to come out. I just learned about recently that may be a lot more natural than the Pfizer and the Moderna. I think the Johnson & Johnson definitely is much more conventional than the other 2. There is one from a plant. It's a company called Medicago, Medicago, and what it does is it takes a plant. That plant makes a type of COVID-19 and puts it into the body of the vaccine. They've actually used this for the influenza. And this is the idea that we keep hearing about spike proteins and mRNA and artificial. Well, they're actually using a plant to actually do this. So this is going to be much more natural and probably much more less biochemical to some degree than a lot of the other ones that are currently out there. The study was just completed. It's a Canadian company, and with this company, what are they seeing? They're seeing about 70% effective for mild, moderate, severe, about 75% effective for moderate, severe. That's pretty good, actually, because now when companies have to do their studies, they're including alpha, beta, delta, and gamma into their studies, where the first studies did not include all these different variants, like delta, etc. You guys have all probably seen that even the current vaccines, the Pfizer and Moderna, are not as well with the delta variant. So potentially at the same level, effectiveness as the Moderna and then the Pfizer. And maybe even better than the Johnson & Johnson. Here's kind of cool stuff, that the side effects are probably less than the Moderna or the Johnson and the Pfizer. And let me talk about actually the Moderna, Pfizer, and Johnson & Johnson for a second. I saw something about strength. The Moderna is the highest strength vaccine, actually, I mean the amount of medicine in the vaccine. Pfizer's the second, and obviously Johnson & Johnson may be the third. So if someone says, I'm more worried about side effects of the vaccine, you may want to consider the Pfizer because it has got less medicine in it. The boosters, in general, have 1/3 the amount of medicine as the originals. I thought it was kind of interesting to know. Or maybe it's not interesting, but maybe I'm a geek about these things. So now going back to this plant-based one, the Medico one, is that side effects wise, they're getting a sore arm, and that's probably given. But what they're finding is that they're not getting a lot of the fevers, a lot of the other quote unquote side effects that you were getting with the Moderna and the Pfizer. So I thought that was great, that maybe the less of the systemic ones are happening less. I'll come back to the systemic ones, systemic symptoms here in a bit. The second one is called Novavax. I touched upon this very early on. This is also more conventional. They actually take a part of the COVID-19, they put it in a nanoparticle and put it into the body. So it's, again, you're not doing a lab and creating something. You're actually taking something that's already there and putting it in. So it's definitely more conventional. And I think that the Novavax and potentially the Medico one should be available next year. I saw something on vaccines and someone saying, a couple doctors I was talking to, about maybe how to get less side effects with a vaccine with some simple way. There's something we call tourniquet. You may remember it, that it'll tie something, you have less blood flow, and that with less blood flow to the arm that you get the vaccine, it may cause less side effects, these systemic side effects to the body. I've not seen a study of this. This is me talking to a couple docs and researching some things. But basically, if you're worried about side effects of the vaccine, one simple thing is get a tennis ball, put it underneath your arm, and you put it there 15 minutes before the shot, up to 15 minutes after the shot, so about a 30-minute period. And you want it to be close enough there where you don't feel the pulse or that there's like less blood flow to the wrist. Again, that's I don't want to say something that someone hurts themselves, but put it on there, hold it, and that's going to have potentially less systemic effects. Systemic effects, what do I mean? We're finding that many times that the vaccine is accumulating in the liver, spleen, and the ovaries, female organs. That's why a lot of the people are having issues with their periods, other things like that. And in terms of what to do is that if you do have liver issues, I recommend doing certain things to protect your liver before you do the vaccines or boosters. If you have spleen issues, same thing. Most people don't think about spleen. Well, same thing, female hormones. If you have female hormone issues already, then I would want you to protect your female hormones or your ovaries, your uterus, and stuff before you get the vaccine. Now, the question about side effects and the vaccine, I looked a lot about it and tried to crunch my own numbers. So before that even, looking at hospitalizations in Ohio, 95% of people that are hospitalized did not have the vaccine. 97% of deaths are happening with people without the vaccine. I found that startling. Whether, again, people doubt true or not true, this is from the Ohio Department of Health. But I found that kind of interesting. In terms of vaccines and boosters and vaccines and first shot, second shot, we do have a protocol for vaccines and what to do for it during and after. I'd probably get a balanced immune system if you are going to get the vaccine. Probably three things. We have something called immune shield, something called T cell, or now a thymus supplement, and Immunomax or Immunocore. All three of those, I'm trying to balance out different parts of the immune system to get it to work properly. Most people, I would say, even a week before, I'd probably get what's called an IV jumpstart. Give the vitamins and minerals to the body so that it can actually do its job for the vaccine and have less side effects. Then, and I'd probably even do ozone a week before also to help balance out the immune system. You get the shot. If you're having side effects, we find three major things. That some people have pain at the site. We're using hemp seed oil cream for that. Muscle joint pain, fatigue, we're using something called Mitoviv or Energy Bite. Fevers, chills, inflammation, SPM actives. And that as needed. And then a week after your dose, getting another IV jump start. You get your second dose. And then if any side effects, you take those. Then you do the IV jumpstart, and then do ozone. Ozone helps balance out the immune system, but then also then helps detoxify the body also. So we've done a lot of people getting prepped for the vaccine, etc., for both the vaccine and the boosters. Let's talk about now some of the deaths, and we'll jump into the protocols. Some people, there is something called the VARS system, might have anywhere between 15,000 and 19,000 deaths. I've seen data both sides saying some of that's true, some of that's not true. Hard to say. For me, some of it could be true. So I said, okay, well, how big of that number is it? That sounds scary. I want is less than one person dying of anything, right? But even if 19,000 people died, how many people got the vaccine in this country? They're saying 200 million people. One of my colleagues said that a Harvard study said anywhere between only 1 and 10% have been reported of people that are dying from it or something. Okay, let's do that with those numbers. So even if 1.5 million or 2 million people died of the vaccine, I don't think it's that high. It's still way less than 1% of people have died with the vaccine. And it's way less than 1% of people who's reported death of the vaccine. Verified, not verified. In terms of vaccine side effects, I've had a couple of my patients have it, for a couple weeks, if not months afterwards. The majority have not. We do assess people to whether they should get the vaccine, not, or based on their past history. One big study I found was about 25% of people will get some type of side effect for the vaccine, but it lasts for a day or two. That was a large study, about 600,000 people. And that was the fevers, chills, etc. I found it's kind of interesting. Who are at risk for side effects? People that are below the age of 55, women, and people that had previously got COVID-19. Those people had more side effects of the vaccine. With that being said, about 1/3 of the people that get COVID, 3-6 months later, maybe even a year later, are still having symptoms. The long hauler, long COVID, etc. And we treat a lot of that here in the office. The long COVID, long haulers, with actually good success. Same thing, we treat a lot of people with infections with good success too. I'll use the word infections and leave it like that. So our protocols, then we go to questions, Q&A. When I'm looking at this, I look at this a few ways. Most of us have seen the KanodiaMD protocols here. So I look at protocols a few ways. One is going to be, what's a great day? How do we live life for the prevention aspect? The number two is like, what supplements, what treatments can we do? And then also, what non-supplement things can we do? And let me jump to the new stuff first. And I don't think we have this on the sheet yet in a simple way. You might have to take notes. What I'm finding is that most people are getting sick with COVID is it's entering the body somehow, nose, mouth, or lungs. And when it enters the body, if the body can't fight it, it becomes sick. So the innovative thing, I think, this time, if you take something away for treatment or prevention, is that we have those nasal rinses. There's one that we have that actually has the data to support. It helps with infections. There's a dental side in which we talked about before, which is the mouth. There's also a throat spray. So I want to protect the nose, the mouth with 2 types of sprays, and I want to protect the lungs. So we're using a nebulizer machine that like we use for asthma. We use something called poly-MVA in that. And when we do that, that's helping protect our lungs. So it might be that doing like a poly-MVA treatment once a week, or doing that, every 2 or 3 days, the lung treatment. But if I can protect the nose, the mouth, and the throat and the lungs, it's less likely to get, in theory, you get the infection or it's less likely to have it. The other really big thing that I'm seeing in the research about treatment is that the reason why it's happening so much in winter times is circulations. Meaning that indoors, we have our windows closed. Indoors, most buildings don't have proper circulation. So I'm going to share my screen. And before that, I'll come back to a couple things. Yeah, no, that's fine. The share screen. Okay. So I don't know if you guys can see my screen or not. I guess kind of weird. I don't think so. Okay, I'm gonna stop sharing. So in terms of on the protocol, we have a air filter now. I think that's very appropriate. It's called Austin Air. There's 2 types. One's for a smaller area, one's for the big area. We have them in the office, we have them at home, at my home, an air filter. So my recommendation is, on top of what we talked about there, is that the nose, mouth, 2 things, mouth, lungs, is get an air filter for your home and if you're around people. So whether for your office, wherever you're socializing. And for areas that don't have air filters, one of the things that we found is to open the windows, to get air circulation going. I know it's a little bit harder during winter time. Now, in terms of the supplements, we haven't really changed them very much. I look at treatment as a couple-fold. One are the supplements, which will have a protocol attached to this, and we'll go through some of that. I think you guys can see this. We have it for people that are vaccinated, what we recommend. And again, one of the unsung heroes is melatonin. Melatonin overall is helping people get better. Not get better, but either preventing disease or making it less ICU or less sepsis. Unvaccinated, what should you be taking? Kids. Then we're talking about if you have health symptoms, chronic illnesses, after supplements, the next thing would be some procedures. So whether you have gut, you have other illnesses, getting a jump start, whether once a week, once every other week, probably helps. So it's the vitamins and minerals, the body for the immune system. Now, if you have autoimmune, or you're high risk, or you want to balance out your immune system, it would then be ozone. Ozone therapy is great. We use a lot of that in the office. And I'd recommend doing these types of procedures during the surge. My recommendation would be between now and probably end of January, because I think it's where it's going to at least peak and come down. If you have chronic illnesses, or if you're out in the general public, etc., I would consider doing IVs or ozone. So if you think you're vitamin mineral deficient, having gut symptoms, the jump starts. If you have autoimmune, you have immune system problems, or you just want to balance out your immune system, the ozone. And most people do both, IVs and ozone together. So ideally once a week until we start coming down. If you can't do it, once every other week. If you can't do it, once a month. Whatever works for you and the family. Now, when I think about the perfect, we're done with supplements, we're done with the nose, the mouth, the throat, we're done with procedures per se. And yes, our protocols are going to have, if you get an infection, what to do also. But let's talk about prevention above those things. We find that worry or stress can affect the immune system. So starting your day, which is visualizing a healthy immune system and feeling what a healthy immune system is from head to toe, is the exact opposite about worry. So we call it focus feeling. So feeling like that you're not going to get COVID, feeling like if you get COVID, you'll be able to fight it off, it'll be easy and free, easy to do, and you feel it from head to toe, and use all 5 senses. Your eyes, your nose, your mouth, your ears, the touch. So what's it going to taste like, smell like with a strong immune system? Number 2 thing is going to help you, big picture, is after you wake up, go outside. Walk for 15, 30 minutes, probably 30 minutes if you can, even if it's cloudy outside. You want to shut off excess melatonin. Excess melatonin shuts down the immune system. You want melatonin at night, you don't want it in the daytime. If you can't walk outside first in the morning, use what we call the retimer glasses. We have them in the office. It looks like you wear something while you get ready in the morning. That shuts down your melatonin. We've gotten great success with that. We also use those for the seasonal affective disorder. Next, wake up without an alarm clock. Wake up naturally. That boosts up the immune system tremendously. Next, there's new research that says don't eat right away getting up. Maybe wait half an hour, 45 minutes. Wait till your belly says you are hungry. Again, we don't want to do too much to the body. I think eating the right foods make a difference. So if you haven't started the KanodiaMD food plan, something to consider. I would take care of your underlying symptoms, whether fatigue, stress, whatever those underlying issues are, work on those, keeping those optimal. Exercise if you're not tired. And with exercise, it's going to help boost up the immune system. I would definitely take your melatonin at night. Also do something fun in the daytime. Something you enjoy, one of your hobbies. That's going to boost up the immune system. And if you can use candlelight, half an hour before bed, and no computer screens, cell phones, that's also going to help the immune system. Now, let's talk about some of these questions that we have. So if you have questions, please put it in the chat box. And I'm going to start with what I see here. And if the moderators have anything that want me to answer, please let me know. I'm going to talk to question about, is there any differences I would do prevention-wise with Omicron? I would probably do all the things I mentioned with Omicron or Delta. One patient said the father of a coworker's husband died of COVID this morning. Sorry to hear about that. After second time getting COVID. He did have health issues, including cancer. One of the things that we are seeing is that even if you are getting the vaccine, in many countries is saying that in Israel, it's 64% effective. I think in the UK, it was 50% effective with the Delta and maybe the Omicron. Another question is, can the testing modalities that we've been using for other web variants detect Omicron? From my understanding, as of now, yes. So the home tests, the testing if you go to some place, able to pick up the variant from what I'm understanding. The question is, are they talking about creating a specific vaccine for the Omicron? That is potential that they might create something for that. But now if Pfizer is saying with 3 shots, it's 95% effective, then they might not need to. Moving on to the next question that we have here. I will stop sharing. The question, I think, from David is, what foods and supplements? So foods-wise, I think sugar is an issue. How about other therapies, like Beamer, ozone, other things? Beamer is a device, a PEMF device that increases blood flow. So better blood flow, better immune system. And with the Beamer device, you can also put that over your thymus or other parts to boost up your immune system. It's a pad, 8 minutes twice a day. If you guys like technology, reach out to our office and we can hook you guys up with a free appointment to try that device out. It's really cool. I'm actually currently, I use a Beamer at home currently. Next question. What about individuals, especially children with allergies, specifically eggs, milk? So what's interesting is one of my family members is a pediatric doctor. She works at the hospital. She was just over my house recently. I asked her about her hospital. It's in Indiana. And she said that it was full of kids, ICU, wards, etc. I was shocked to hear that. I don't really hear that in the TV much, but she was saying yes, that COVID is affecting kids. So just to give you an FYI about that. I have not seen anything about milk or eggs as being a contraindication for the vaccine for kids. The question is, will the plant-based Canadian vaccine be at our office? I do not know. If it becomes available in the US, we can definitely look at carrying it in the office. That's a great question, great thought. There's a question that how much ozone during surgery? I don't understand that question. So I would defer that. The question, I guess the last question I see from Dawn is how effective is a Pfizer booster if you had the Johnson & Johnson initially. I don't have any studies on that. I would say that probably a Pfizer or a Moderna booster probably more beneficial than a second Johnson & Johnson vaccine. Based on the data I'm seeing, I'd probably go to a Moderna booster. Technically, probably have more of the medicine in it than the Pfizer, but I have not seen any data. I get Angela's question. Thank you for the there is how much ozone during a surge? My recommendation is probably once a week right now, because I'm seeing the effects when people get COVID or long haul, etc. If you can prevent it and have a better winter with your friends and family, and preventing being hospitalized, I think it's worth it. But again, as much as you can do, I don't want to cause stress to the family or stress coming here or anywhere. Do that. And when I say once a week, I'm talking about the IV version, not the rectal. Question, is there data about which home tests are the most accurate? There are data out there. I have not looked at all of that to say this is the best one. Last question for tonight is that any wisdom of cleaning out your liver? Yes, I think the detoxing is helpful, but that would not be my first place I would spend my time or energy. In terms of, I'd probably do other things first. Working on stress, the exercise, the right foods. And then yes, I think detox is valuable, especially the strong sense of smell. And what I mean, if you go to a perfume store, candle store that bothers you a lot, you won't even go into it. A lot of people say that your liver has the worst of a detox. For those types of people, yes, a liver cleanse will probably be better. All different types out there, it's a whole separate discussion. So I try to give you guys some information tonight regarding where we are with the surge, what is the Omicron variant, vaccines, some data both sides, probably more on both sides I could probably give you, and some of our protocols. We're here to help any way we can. We want to be your advocate, your supporter through this pandemic. I have a passion for the research, a passion to help people who want to get better with common sense, both the medical side and the alternative medicine side, so that we can give you your best options. So if you found this helpful, obviously please send this to your friends or family when the link comes out. Please sign up for our email list if you guys haven't already. When this comes on Facebook, please like it and follow us on Facebook. Same thing when this comes on YouTube. Please like it and subscribe to us on YouTube. We really appreciate it. I'm really happy that everyone came on today who came on to get the information. Information is power. And with this power, you now have the power to make decisions that are best for you and your family. So I really appreciate all the thank yous there. It does take a lot of work for me and our team here. We will keep the, So thank you guys all. Look forward to seeing you guys soon. Okay, bye-bye.